Welcome to Digital Health Talks, where we explore how technology is transforming healthcare delivery. I'm Megan Antonelli, and today we're diving into an exciting conversation about AI innovation in home health. Joining us today is Janice Riggins, Chief Clinical Officer at VitalCaring, leading groundbreaking initiatives in AI-powered cognitive care. We'll explore how they're pioneering AI-driven cognitive care to meet the growing challenges of Alzheimer's, dementia, and other cognitive impairments. Hi, Janice. How are you today?
I'm great, Megan. How are you?
Good. Thanks so much for joining us. I'm so excited to have this chat. Having kind of just learned about VitalCaring and all that you guys have been involved with, but share with our audience a little bit about your background and your role.
Sure, thank you. It's a pleasure being here with you. And I've actually been a registered nurse for 30 plus years now. And most of that time as being a registered nurse has been practicing in the post-acute space in home health and hospice. I will say I fell in love with home health while making rounds with a cardiologist years ago. Believe it or not, they were still doing home visits back in the day. And at that time, we were actually doing rounds for patients who were undergoing cardiac bypass surgeries. What I discovered when making rounds in the home setting was so much different than caring for patients at the bedside in the hospital. I was able to really learn so much more about the patient and their healthcare journey by stepping into their environment and identifying ways to teach and assess and identify root causes of their illnesses, associated with social determinants of health that you just didn't see. You didn't see that in the hospital. And so for me, it was that moment when I really became hooked on post-acute care in home health. I knew that meeting the patients in their home to provide care was my calling. And that's kind of my journey. I started there and since have moved on into executive roles in the past 20 years. Absolutely love it.
That's amazing. I mean, what's so interesting, I think, also as we look at kind of how telehealth and telemedicine has evolved. I mean, I remember back when it was really just beginning, and it really started with the home health nurses. I remember the Home Health Nursing Association of New York and the programs that they had. It makes sense, right? I mean, obviously they were not connected. They needed to communicate, and we've had other folks on the show, around just that lack of communication and that lack of connection that, for those nurses and those caregivers, and that there was so much innovation there because it was needed. And now here we are. And it's interesting as we see this sort of convergence between the two. But tell us a little bit about VitalCaring and VitalCaring's mission and, what you do there.
Sure. So I work at VitalCaring now. We are a home health and hospice provider that has fairly new to the industry. However, I would say that our team is not new to the industry. So we have a lot of great pioneering leaders within VitalCaring, where we really formed multiple home health agencies over the last few years into one umbrella or under one umbrella of VitalCaring. And our mission here at VitalCaring is simple. Our mission is to transform lives and foster hope through genuine caring. And really, for me, that means not just caring about the patient, but making sure that our employees are also cared for and that they are provided the skill set and the tools to be able to do their very best with every patient, meeting them again in their homes along their journey of home health. And for us, home health is not transactional. It's not just about the visit within a 60-day episode, but it's about making sure that we are really achieving goals to allow patients to age in place, and that is in the best place, which is their home.
Right. Yeah, we've had a lot of conversations about that too. And I do think it's so important, particularly with cognitive, right, disabilities and dementia. I mean, they want to be at home. They are at home, and the caregivers, at home need help as much as you can provide that. So tell us a little bit, as we've been talking, as I said, to folks also working in the aging in place space, but also with the hospital at home and, the technology initiatives that are behind that. Tell us a little bit about where you see, that impact and how that's impacted the changes that you guys are making.
Sure. Well, like you mentioned earlier, going way back in the day when telehealth was really introduced in the home health setting, that hasn't changed. Although our reimbursement, unfortunately, is not catching up to the technology, we have definitely found a sweet spot in home health in the post-acute world where we see that technology is so very important. We are partnering with our hospital partners for hospital at home and such programs that really allow patients to age in place to be able to transform care in the home setting at a much higher skill set. And so that's what's so important is that we are seeing patients coming home sicker, they're coming home quicker. We've heard that for years now, and it's definitely come to fruition. And what technology has been able to allow us to do is really to be able to take thousands and thousands of data points that the human brain just can't really compute and be able to formulate that into individualized care plans and care initiatives for patients, especially those who are suffering from cognitive issues and impairments. When you think about just in our population here at VitalCaring, we have well over 10% of our patient population with a primary diagnosis of some type of cognitive impairment. And that's not even including your secondary or comorbidities. So there's a much, much higher prevalence of that. And so we're seeing this more and more. And we need to really partner with our upstream partners, both hospital and rehabilitation centers, to then use technology to transform the way that we are uniformly providing care across all of our service lines.
Great. Well, and then in that, and I think it's really interesting that the way that this has evolved around the cognitive care, you know, area. And tell us a little bit about, the pilot program that you guys have been working on, because that's kind of how I came to this and what's going on there.
Yeah, absolutely. So at VitalCaring, we had a cognitive care program. It was a clinical program where we were involving both therapists and nurses to provide teaching and education to both our patients and our families. And like with any other disease process, you go in for home health and you have a visit and you try to get as much done within that visit. But then what happens on the off days? What happens on the days when you don't have a nurse or a therapist in the home? That is where we found that we needed to solve a problem for. We needed to figure out how do we ensure that patients and caregivers can become as engaged as possible while they're receiving the therapy and the treatments while on home health, but also in the interim, in between those visits. With cardiovascular, with stroke, with diabetes, we send nurses, we send therapists, we teach them, and we have teach back to teach them to how to do or perform their therapeutic exercises. What they do then, we are unable to really monitor or measure because we can only take the word of what that patient says they're actually doing. We wanted to be able to use technology to measure what happens in between those visits so that we can see the progress and the engagement that was happening with our patients. So we had a pilot program. We started with a small scale so that we can really measure and manage it. We had 52 patients within our pilot program, ages between 54 and 92. So on average, our patients were around 77 years old. The program on average lasted for 77 days on average for each patient. The pilot itself went on for 7 months in duration. And what we found is not only did we see improvement in cognitive function, 55% of our patients improved at least one cognitive level. 35% of our patients achieved normal cognitive function score by the time of discharge. But what I also loved about this program was that we saw on average 557 hours of additional therapy outside of our in-home therapy visits. So when you're able to engage patients and family members, and then you're tracking those hours that they're being performed, that is how we were able to then get the results that we saw in such a small pilot that we performed.
Wow, that's amazing. I mean, and that covers another thing that I think is so interesting around as we talk, and there's certainly fear and concern around what AI can do and the ability that, to amplify care, to offer more care, and to offer the services that you're not able to offer because there just aren't the resources to do it. So it seems like you guys have really gotten to that. Tell me a little bit about how AI is kind of central to this project.
So AI was so important, for us. I think on so many levels, we look at technology on, not trying to complicate or create, or replace our nurses, but it's really an adjunct to add to the care and services to be able to elevate their skill set by providing them with information, clinical decision support. So it's allowing them to really individualize their plan of care. So when in front of the patient, being able to go back and look at the hours that the patient has already used within this exercise program, they're able to take that and then tweak the plan of care to progress. So it's not a one size fits all. Every patient is receiving the right amount of care at the right time and the right type of brain exercises that they need to really improve within their cognitive impairments. For me, I felt like that was such an elevation of our clinicians. They were so excited to see the progress that was being noted within our cognitive care program. It wasn't a matter of just leaving a handout and saying, here's your booklet, and let's see if you can remember or recite these things. It really engaged the patients and family members, which is why I say, even after discharge, we found that most patients and family members wanted to continue with that program because of the experience that they had while on services with us.
Wow. I mean, that's impressive. I mean, in terms of just that level of impact, and I think, like, did you say 35% showed improved function? I mean, that's amazing. What, in terms of, you've seen these programs in other places not have that kind of impact. What do you think contributed to that? Is it the engagement of, do you use tools like, is there gamification, or is it just that in the customization? What is the special sauce, if you will?
Megan, I would say all of the above. So, the program was very intuitive. It adjusts to the level of difficulty based on the patient's performance. So when you think about it adjusting to the patient's performance, with cognitive impairment, a lot of times patients become frustrated when you're trying to work through certain exercises and brain activities. This allowed the patient to engage more with decreasing the amount of frustration, if you will. So Constant Therapy has a proprietary patent program which they call the Neuro Performance Engine. It's the NPE is what they call it, which really analyzes, real world data generated from the user interactions with the product delivery, evidence-based exercises that are customizable to each and every patient. And by using that and allowing our clinicians to then collaborate with both patients and family members, we saw that the level of engagement increased, and that's where then we saw the level of hours in between visits start to improve. Time and over that course of the episode of care, or on average, like I said, 77 days where our patients with cognitive impairments were on services for. So it really helps provide examples. Would be maybe we needed to slow down the instructions within the brain exercises so that the patient could comprehend and feel like they were achieving at a level and pace that allowed them to be successful. So it was able to adjust verbal cues and questions, slow down, speed up based on the patient's needs.
Wow. And then around, when you mentioned also the them continuing with the program, right? So what do you think is the driver there? Is it the patient, the individual, the family, again, all of the above?
All of the above, absolutely. I would say that, when you have a caregiver who a lot of times with cognitively impaired patients, there's a level of frustration as well. And so when you start seeing your loved one improving or being able to maintain at the level that you were hopeful that they would be able to maintain, it's like the best medicine that you can give a patient without actually having to go down the pharmaceutical route. And this is what I love about this program. If you think about every disease process that we teach on, there's two factors or interventions that we always teach on, and that's diet and exercise. And it's no different here with our cognitive patients. They need good, strong, healthy nutrition, but they need exercise, and that's brain exercise, functional exercise, and that is really what helps to elevate their level of improvement and ongoing, and I would say muscle memory. I think when patients feel like they are being successful and they are feeling a difference, they're going to want to continue to do that. You want to do what makes you feel good. And that's what this program does.
Right. Absolutely. And I think that, the impact on both the caregivers and the patients can't be understated. When it comes to, okay, so this is the pilot, what's next in terms of, what does full scale implementation look like and what needs to happen?
Yeah, so after the pilot, we obviously looked at all of the great measures and outcomes. We recognized that this is definitely a program that we want to scale across our platform, and that's what we're currently doing right now. Is we're developing some more educational materials. We actually want to get our data peer reviewed and get into a white paper so that we can share that with other resources and other healthcare folks, so that we're all working in tandem to improve our overall outcomes for our patients. So yes, we're looking to also enhance. Right now within our pilot, we really focused on speech language pathology and occupational therapists as the driving forces of the pilot program. And now we're looking at ways to expand that into nursing. Obviously, with staffing challenges, especially in some of those therapy areas, we know that in order for us to scale at a larger capacity, we need to involve the entire interprofessional team. So that's what we're doing now.
Great. And then you had mentioned your technology partner in the program. Tell us a little bit about that, how that works and how that's going.
Yeah, so we couldn't have better partners than Constant Therapy. I will say one of the things that we really aligned with, we were very like-minded in our mission, and that was really to foster hope and transform lives and through genuine caring. And in reading their history and their background, that is exactly what they were trying to do as well, is how do we improve cognitive impairment when we know that this is on the rise. We're continuing to see cognition as some of the driving forces of hospitalizations and patients not being able to age in place in their homes. And so that was once we aligned with our core values, one of our core values being technology and innovation, we knew that this was a great partner because they wanted to meet us to really help solve the problem, to really identify how do we get to the root cause and not just put a Band-Aid on it by, again, providing pharmaceuticals or treatment that tends to only be as good as when the patients and families are actually performing it. So this was a great way for us to see how we can continue even long after discharge, providing the necessary services and the exercises that these patients needed, and at a price that they could also afford. And I think that's the other piece that we worked with Constant Therapy on as well, is making sure that for patients that would continue on with that therapy treatments, that they would be able to afford that treatment.
Right. And that's, I think that's so important. And I think especially with cognitive care, programs that, they become, hard to access and difficult to afford for folks. And, particularly, those who are also have other comorbidities happening that they can't necessarily go outside of the home for that. Tell us a little bit about in terms of the technology and what was involved and where you think that, kind of role. We talked about this a little bit already in terms of like patient independence and engagement. Talk a little bit about how the AI, made a difference. I mean, maybe also in the context of like where this has been to where we are, right? And why this is possible now.
Yeah. So I kind of break it out into a couple of buckets, if you will. So from a clinician perspective, I would say that, using this technology, being able to provide objective evidence-based data, to apply functional tasks and support medical necessity is a win-win. We all know that under home health, we're always under regulatory scrutiny and always trying to ensure that we have the ability to document and to prove up medical necessities. So that was another thing that we felt like with our partnership with Constant Therapy that we were able to do. We were able to provide that medical necessity, drive the actual documentation and treatment plan within the Constant Therapy app, and be able to simply copy and paste a lot of that key information into our EMR system. So it helps with efficiencies for our clinicians. It really helped to support and drive home the homebound status as well as the medical necessity, but also the progress that was being made throughout the course of treatment. And then when we think about our patients, it allows them to really receive a much higher level of care than what we're simply able to provide during a visit. So they're getting all those hours additional that's going to help to provide them with the additional care needs. Like I said, I think 557 additional hours outside of the care and treatment that we were able to provide. So that was a win-win as well. Like I said, the limitation that we have with the therapeutic programs that we provide, the patient or caregivers must have either a smartphone or a tablet or a computer. So it's computer or tablet or smartphone agnostic, but you're going to need to have one of those devices in order to really participate in the program as it is today.
Got it. Which is, I mean, it's definitely a bar. And of course, we talk about the kind of digital divide that can create, but there is, it's not a separate device or a unique programmed tablet or anything like that. So
Right.
it's just a web-based platform,
I
right?
would say web-based, which makes it nice because if you think about, going to your doctor's office, most of your physician appointments are web-based now. There's so much telehealth going on. Your reminders are all, generated through some form of technology. I think that, when we leave our houses every day, most of us are coming in contact with some form of AI, whether it be through our GPS system, getting us from point A to point B, whether it's ordering food and tracking, the distance at which they're going to be arriving. So we're using AI technology each and every day. And so being able to apply it, for the greater good of our outcomes for quality care and being able to age in place much longer, that's a win-win for all of us.
Absolutely. And you mentioned around, as we talk about home health and the hospital at home programs and the reimbursement is a factor here, right? And so my understanding, Vital Care is part of the home health program. And so that's how patients would access it. And then once they're done, they would be paying for it for them by themselves. What is in terms of kind of your expansion growth, is it more home health partners? Is it insurance? What's the sort of path in terms of the ROI metrics that you need to demonstrate, but also just looking at some of the challenges and implementing this, right? I see those as sort of probably one and the same, but if they're different, then let me know.
Yeah, no, I think you hit on a very important piece there. It's always a challenge when you have to look at technology and while they're on the home health services, they're able to, the technology is paid for through our episode of care. And then once we have to transition them off, we want to make sure that they're still able to perform their activities and exercises. And so, yes, that is a small fee that they would then continue on through that course of period. But to your point, I think it is important for us. It's not just about the patient having to pay out of pocket. We want to be able to go to strategic initiatives and through insurance programs and other strategic initiatives through ACO populations and others to say, here, we have a wonderful tool that we can help to reduce costs, improve our outcomes and our quality. And again, it being a win-win situation for all. And so I think we can leverage this type of technology layered on top of our already wonderful clinical pathways to sell that to our insurance partners so that we can improve overall our relationships and partnerships there as well.
Right. To make it ultimately part of, a Medicare benefit and that people can access. Absolutely. Around, you talked a little bit about the technology. Are there any other, sort of barriers in terms of having a web base, which, is a barrier, but it's sort of the barrier of all digital tools, right? In terms of other barriers besides reimbursement, do you see, are there challenges that you guys are, seeing that you wish would go away?
I think that, the reimbursement piece is probably our biggest challenge.
Right.
And clearly we want to make sure too that if patients are unable to afford a piece of technology, how do we partner with technology, companies to also be able to provide such devices at lower discounted rates, or so really trying to expand our tentacles out into the technology world. And when we get technology and healthcare together, I feel like that the opportunities are endless. So it's just a matter of knocking on doors and really identifying ways that we can empower other partners to be part of this wonderful outcome, and see the benefits that we can create together.
Yeah. I mean, I think it's such an important area, and there's so many different initiatives where it would align, right? I mean, there's a large discussion around sort of the elderly population and loneliness, right? And how are we? So I imagine while this is very specific, that this would have some, certainly relevance and applications there, as well as, the caregiver movement of, the challenges. And I think dementia is probably one of the hardest
Yeah.
on the generations. So.
You hit the nail on the head. The percentage of, and I don't know the exact percentage of patients with depression, but in the elderly population, but it runs rampant. And so that is one of the validated tests that we also perform, aside from just the cognitive test and standardized tests that we look at. We also do screenings for PHQ-9 and the geriatric screening tool, because within this program, it also addresses those needs for patients that are suffering from depression as well.
Mhm.
And
And I mean, in some ways, I mean, this is a super non-clinical way of looking at it, but in the world of mental health, I mean, teenagers and adolescents going through, their challenges, it just happens. We take it as the accepted norm. As elderly get older, we all get to a place where this is, we have cognitive uh, impairments, whether it's Alzheimer's, dementia, or, just I can't remember what I went into this room for, which
did I drive home today? I don't even remember doing that, right?
right. I'd like to think it's because I'm distracted, but it's mostly because I'm old. But it's so, in that this is, well, obviously you're functioning in an acute place where people need this because they went into a home health episode of care. The opportunities for it to have applications well beyond that, similar to, Talkspace or, the sort of standard mental health application seems logical to me. Is that sort of the next step, or, more?
Yeah, I think there's just so many opportunities that we are just beginning to kind of unravel, if you will. I definitely love thinking through, how do we solve some of these issues with our elderly patients, and suffering from depression, suffering from cognitive, suffering from traumatic brain injury, long haul COVID, all of these things that have played such, major factors within their health and healing. And when you think about, we sometimes tend to trump a lot of things under the fact that, it happens with age. But the reality is, when you really get to the root cause of things, it really is more about our environment. It's more about our lifestyle. It's our Western diets, you name it. That you put all of that in with technology that is able then to formulate an individualized plan and be able to help solve for so many of these problems. It's the future is just, I'm excited. I'm excited about it. I went back to school back in 2018 to get my master's in healthcare informatics, and it was because I really saw a need to marry my clinical experience with technology, because it just makes sense. Our brains just cannot compute as quickly as all of the AI generated information that we receive in order for us to have those outcomes that we want to have in the time that we want to have them.
Yeah, it's so true. And it is amazing. And the potential has always been there. And, I think the discussion of who's going to pay for it has also always been there. But when you do have tools that really make an impact and really have evidence behind them, the progress happens and it moves forward. So I mean, you kind
I'm
of
hopeful. I'm hopeful.
Yes, yes. Well, as we always talk about, we like to close with kind of what's good in healthcare. We have a segment, 5 good things that we do every month. But I like to always ask folks, what are you most excited about? What are the good things happening? And you just touched on a little bit, but in terms of just that, the bright spots in healthcare, tell me what you see.
Well, I think it goes back. The bright spots that I see is that at the end of the day, regardless of policy, regardless of regulations, everyone is someone's favorite person, and so we have to get back to the fact that we're here to take care and to serve our patients, and that's what gets me up every day. That's what I enjoy seeing and I enjoy doing, and so regardless of the political strife or technology challenges that we have from getting reimbursed, it doesn't change the fact that we have an opportunity to change the trajectory of our patients in a positive way, and that's what keeps me going every day.
Yeah, no, it is. It's an exciting time, and I think the AI and technology and that intersection of what's possible is becoming, really exciting and positive.
And
So.
hopefully we'll narrow the gap soon. So
Right. And there's always nothing's going to be perfect and nothing's going to solve everything, but one step at a time there is, changes that are happening. And this is such an important area. So thank you so much for the work that you do. And thank you for joining us.
well, my pleasure, Megan. It was great. Thank you.
Yeah. Thank you. A special thanks to Janice Riggins for sharing VitalCaring's inspiring journey in AI innovation and their impressive pilot results. Your insights on balancing technology with compassionate care are invaluable for healthcare leaders navigating digital transformation. So thanks so much again for joining us. And to our audience, for more episodes focused on healthcare innovation, follow Digital Health Talks on your favorite podcast platform. This is Megan Antonelli signing off.